and welcome to Medical Dialogues. I'm Roshni. Let's look at today's top health news. The Union Ministry of Health and Family Welfare has released expert consensus statements defining admission and discharge criteria for ICUs for the first time. Compiled by 24 experts, these guidelines address various aspects of ICU management, that is ICU admission criteria. Admission should be based on organ failure, need for an organ support, or anticipation of deterioration in the patient's medical condition. Patients not admitted to ICU, patients with informal refusal, treatment limitation plans, living wills against ICU care, terminally ill patients, futile and low priority criteria during resource limitations are not admitted. The ICU discharge criteria. Discharge conditions include physiological normalization, stability of acute illness, agreement for discharge due to treatment limiting decisions, lack of benefit from aggressive care, infection control reasons, and explicit rationing policies during resource crunch. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. For this minimum patient monitoring while awaiting ICU bed, the continuous or intermittent monitoring of blood pressure, clinical parameters, heart rate, oxygen saturation, capillary refill time, urine output, neurological status, intermittent temperature, and blood sugar is required. Minimum stabilization before ICU transfer, secure airway or adequate oxygenization, ventilation, stable hemodynamics, correction of metabolic disturbances, and initiation of definitive therapy are required before transferring a patient to ICU. Minimum monitoring for inter-facility transfer, continuous or intermittent monitoring of blood pressure, clinical parameters, continuous heart rate, continuous SpO2, and neurological status is needed for transferring critically ill patients. These guidelines aim to enhance patient care, streamline admissions, and ensure efficient use of ICU resources. The criteria are outlined using the Delphi methodology, with consensus achieved when voted by 70% or more experts. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.